Okay, so then let's talk about the hip joint. So again, draw that imaginary line that's in anatomical position. And what she's doing, she's kind of kicking forward, that's flexion. Again, this is yet another thing that fits with that rule of thumb. Generally, movement toward the anterior is flexion. So what she's doing, she's decreasing, actually the angle should be here, but she is decreasing the angle between her upper body and her leg. And what's this guy doing? He's kicking and he's doing stuff, but what is he doing at his left hip? He's doing flexion of the leg because again, oh, this one's highlighted correctly. So again, in anatomical position, his upper body would be aligned with his leg, but by bringing his leg closer to the body, now it's decreasing the angle, causing, and this is flexion. Now, hyperextension. So what do we see here? Again, we're talking about extension or flexion at the hip. So what is she doing at her left hip? She is definitely hyperextending, like crazy hyperextending. Like if her upper back, or actually she's hyperextending her back too. But why do you use this? It's really extreme. It's crazy. Like, so then what we see here is like if she was in anatomical position, her torso would be up here, her leg would be over here. But she's kicking that left leg way back. But what about her right leg? Is she doing flexion or hyperextension? Actually, let's ask the chat. So we're seeing that in her left leg, she's doing hyperextension. But what about her right leg? Is she doing flexion or hyperextension? Left leg at the, or right leg at the hip. So it looks like most people are saying flexion, and most people are correct. So again, she's doing flexion because if her right leg was in alignment with the rest of her body in anatomical position, it would be down here. But she's kicking it forward, decreasing the angle between her leg and her torso. So yes, you are correct, most of the chat. She's doing flexion. So this is another tricky thing and why you need to pinpoint which joint you're talking about when answering this question. Same figure, same person, but she's doing flexion with one leg, but hyperextension with the other. So again, this is also why it's important to know left and right, because again, here we have her right leg doing flexion, but her left leg is doing crazy hyperextension. So yeah, would this be considered hyperflexion? Yeah, that's why it's like flexor. I think in this class, don't worry too much about hyperflexion in this class. Most of the times I've seen that term hyperflexion refers to some sort of pathological, past normal ranges of flexion. Like, is it flexibility? Well, I think when I've seen the term hyperflexion, it usually refers to like some sort of extreme flexion angle that causes some sort of injury. But I mean, I've also heard of like people like her, like who are way past the bell curve, like above us mere humans in terms of flexibility and moving something past hyperextension. Sometimes it's considered pathological, but don't worry so much for this class. So would this be hyperflexion? Yeah, don't worry too much about hyperflexion for this class. But yeah, she's flexible. Yeah, so again, another example by how flexible does not necessarily mean flexion. So again, she is doing flexion on her right leg, but her left leg, she's very flexible in her left leg, but she's hyperextending it. Again, oh, so then luckily, so if you're kind of squeamish, look away right now, okay? So, yeah, her neck would be considered hyperextension, but yeah, if you're squeamish, don't look right now. Okay, so I'm not going to show the result, but did you notice what he was doing? He was locking his knee joints. He was also pushing his knee joints. If you really want to see this later, don't see if you have a weak stomach, but you know how your knees are supposed to kind of go like this? Let's say the result is that his knees go like this. Yeah, so if you have a weak stomach, do not look at that. But again, that's why I say do not lock your knees when doing these presses, especially if you're trying to push these heavy weight. And for God's sake, do not, you saw how he's pushing his knees? Again, they're not supposed to go that direction. So again, I stopped it because again, it gets pretty gnarly in that one. So again, if you're doing that stuff when gym's open, do not lock your knees. For God's sake, do not do that. Okay, why do I bring this up? Again, most flexion is toward the anterior, but your knee is special. If your knees naturally go this way, but your knee ends up going this way, you're in for pain city. You're not okay. So the knee is a big exception to this general rule of thumb. Like most flexion is toward the anterior, except the knee. Again, oh my God, you've actually seen that at the gym? Oh, yeah. Oh man, that poor guy, like, or girl, whoever did that. Yeah, that's scary. So again, do not lock your knees. Engage your muscles. Do not lock your knees during those leg presses. So again, your knee is an exception. Naturally, you can bend it easily toward your posterior, but can you bend your knee toward the anterior? So again, your knee typically bends this way. So knee flexion is toward the posterior. So again, this is a big, but it's still decreasing the angle. So this is where the decreasing the angle definition still holds up. You start off with anatomical position with the thigh and calf in this position, but you decrease that angle by flexing it toward the posterior. So the knee is the exception to that anterior posterior rule of thumb. Now look at his right knee. It's like, this is an anatomical position, but his knee is going straight forward. I mean, it's not straight forward, but it's actually going way past forward than normal. So yeah, this guy is in extended position right now. He's probably going to, I hope he didn't tear too many ligaments, but again, your knee should not flex forward past anatomical position. Well, actually, I did more research. So this also kind of comes up in like the live class. Like there's always, and for some reason, I think maybe due to like how women are generally more flexible than men, some women, it's always been female students that come up after, and when they stand or sometimes when they walk, they actually hyperextend their knee a little bit past 180. And then I reread more, and a little degree past 180 isn't too pathological, but when you're like at this angle, yeah, that's kind of pathological. And again, if your knee naturally has some hyperextension to it, this is another reason why you shouldn't fully extend your knee when you're doing these leg presses. Again, your knee is much more stronger in this direction than it is in this direction. You don't want it folding and your legs becoming like a chicken's or bird's. Knee joint flexion is how you normally bend your knees. Yes, that is correct. So again, how you normally bend your knees is knee flexion. Your knee should not hyperextend to a great degree. That is pathological, as you can see by this poor football player's right leg. You can see it's definitely hyperextended. All right, so ankle is a special movement. So again, in anatomical position, your ankle and your foot's pointing forward. So it's like, okay, if you move it either way, say the ground wasn't there, well, you'd be moving it toward the posterior either way. So that's why ankle has a special movement. This ankle flexion, it is decreasing an angle, but they also have this term called dorsiflexion. So dorsum means the back. So this is like the back of your foot right here, or like, yeah, kind of like the back of the foot. So it's ankle flexion, it is decreasing the angle. So know that ankle flexion and dorsiflexion are one and the same. But remember the sole of your foot, your anatomical directions. So that's your plantar region, right? So when you're moving your ankle toward the direction of your sole, then basically pointing your nose, you're pointing your toes, and pointing your ankle, and pointing your foot, that is ankle extension. So you're increasing the angle between your ankle and your lower leg. So plantar flexion is toward the plantar region, your sole of your foot. Dorsiflexion is in the opposite direction, toward the dorsum of your foot.